I'm Dr. Kumar Dussa, a practicing orthopedic surgeon. Today we are going to talk about the most common condition around the knee joint, that osteoarthritis of the knee joint. So it's a most common type of arthritis seen in the Indian population to an extent of 30%. Unlike the inflammatory arthritis like rheumatoid arthritis, osteoarthritis is a degenerative disease of wear and tear. So as the age advances, the smooth, gliding, glossy articular cartilage gets thinned out, eroded, and the cushion-like pads in the knee joint also gets eroded. So the oily fluid in the knee joint stops lubricating the joint. The bones become soft due to osteoporosis and there sets in deformity of the knee joint. So the patient experiences progressively increasing joint pain. There is swelling, there is deformity and difficulty in sitting on the floor and squatting position, which the Indian population likes it. What are the risk factors? The risk factors is obesity, any prior injury to the knee joint and any previous illness, infection around the knee joint. Now, how do you diagnose osteoarthritis? A very simple method by taking a plain X-ray in standing position. What is the steps for management? I would divide the steps for management into preventive and therapeutic. So the preventive plan is weight reduction, diet modification, lifestyle modification. Lifestyle modification is you just walk for a few minutes every day, say 15 minutes in the morning, 15 minutes in the evening. While sitting in front of a television, do leg lifts. Build up your muscles around the knee joint, the front muscles and the back muscles. You know, 60% of your body weight can be transmitted through the muscles around the knee. So the load on the knee joint will be absolutely less. You can use local splints like kneecaps or advanced splints in later stages like you have knee offloader braces. You can have simple therapies at home like hot water fomentation and alternate with cold water fomentation. Use local application of analgesic creams you get. Painkillers have to be avoided and or used judiciously. Physio is the best thing. What do you do in physio? Short wave diathermy or knee bending exercises, muscle building exercises, strength building exercises, so that both the limbs are placed adequately to take both the load of the knee. Local application of heat and cold therapy is advised along with local application of painkillers, but definitely avoid taking oral painkillers without a doctor's prescription. What are the newer medicines in osteoarthritis? They are called as food supplements. The chief ones are glucosamine sulfate and chondroitin sulfate. What do? They prevent cartilage degeneration and they create an environment in the knee joint for frictionless movement at the knee joint. What is beyond in the later stage of arthritis can be done? You can give the injections directly into the knee joint, which can create this viscose supplement effect and give lubrication to the knee joint. After this, if the stage is still further, you are landing up with surgical treatment. Surgical treatment are mainly in the initial stage. You can do arthroscopy for joint lavage and removal of any mechanical loose bodies. In the later stage, depending on how much of the joint is affected, you can do partial knee replacement or total knee replacement. Now, total knee replacement is the most rewarding surgery. The patient is able to walk pain-free, full knee range of movement in the next day immediately after surgery. The advances in the pain management has improved so much that knee replacement has become a wonder surgery in the present era. I would suggest patients who are having continuous pain, swelling, stiffness, please do visit your orthopedic surgeon, get it clarified about the type of arthritis, and do not neglect. My sincere request to all of you to please take care of your knee joints.